We gather here today to launch the first single-payer healthcare system in America. To do in Vermont what has taken too long. Have a healthcare system the best in the world that treats healthcare as a right and not a privilege. Where healthcare follows the individual, isn't required by an employer. That's a huge jobs creator. Where we all win and we all pay. Most importantly, a healthcare system that is sustainable, that spends our healthcare dollars making Vermonters healthy, not on insurance company profits and not on waste and inefficiency. We will get this done in Vermont.
Vital had actually started working before the federal government started with the Regional Extension Centers program. Vital had been working with a number of physician practices around the state, helping them adopt electronic health records. And we had also started with hospitals and working with them on building interfaces to the Health Information Exchange. What the Regional Extension Center program did, though, was it provided quite a bit of additional funding, which enabled us to expand the scope of what we were doing and to reach out to all of the state's primary care providers and to offer them assistance with EHR adoption and implementation. And almost all of the state's 1,000 primary care providers have taken us up on the offer and have signed up for our Regional Extension Center services. And we have now over 700. I think the latest count was we have 816 primary care providers that have functional EHRs, and 330 of those have achieved meaningful use. And we expect many more to achieve meaningful use this year. We do offer direct as a product to Vermont healthcare organizations, but we have primarily been using interfaces. We have more than 300 different interfaces that connect hospitals and physician practices to the Health Information Exchange. On the map of Vermont behind me, you can see a number of pins that have been put in, color-coded pins, and each one of those represent a healthcare organization that is connected to the Health Information Exchange. We have pretty much all of the state's 14 hospitals connected, and we're just finishing up with the last few of those, and those are represented by the blue crosses that you see on the map. And then there are also physician offices and other types of healthcare organizations. The basic idea is that we are helping them with the information technology portion of doing that. Some of the pins that you see behind me are color-coded blue, and that's what means those pins represent the blueprint for health participants in the various practices. So we have, what we do in that regard is we have built an interface between their EHR and the Health Information Exchange, but it's been set up in a way to meet the data requirements of the Vermont Blueprint for Health program. And then the data from that interface is then not only put into the Health Information Exchange, but also goes to the clinical registry that the Vermont Blueprint for Health uses. And the reason that there's a separate clinical registry is because that has some very deep and useful analytical tools that the providers that can then use to look at their data and then to identify opportunities for improvement. There are community health teams in each area, each hospital service area in the state. And so what they are able to do is to use that data to then work with the patients and to help them get the care that they need, help better coordinate the care for those patients. They go through the medical home scoring process, and then what that is what that does is that is then used to determine payments. The state provides payments to the participants in the Blueprint for Health so that they have some additional resources that they can use to provide more coordinated care to the patients that are enrolled in the program. We have been working very closely with the board. In particular, Vital and Health IT is seen as an enabler to the greater healthcare reform effort that is going on here in the state. A very critical component, and so that's why our president and CEO, John K. Evans, has been meeting with the Green Mountain Care Board chair on a fairly regular basis. She's actually a member of the Vital Board of Directors. And so we have been coordinating with them, and part of that is the Accountable Care Organization movement is going on in the state. There have been several that have been set up, and there may be more. And so we do intend to work with those accountable care organizations as well, and to try to assist them in their work. So we very much are looking towards that goal of is helping the state with its healthcare reform efforts.